Alright, we're gonna go ahead and do foot care. I already did my opening. I brought in my gloves, my barrier for the table, drying towel, 2 washcloths, okay, a basin, soap, lotion, and another barrier for the foot. So I'm gonna go ahead and put on my gloves first. Okay. Expose the foot that I'm going to be washing. Place the chuck underneath so the bed doesn't get wet. Fill this up with water. Check the temperature. Ask the patient to check it. She says it's okay. We're going to go ahead, Ms. Smith, we're going to go ahead and soak your feet for about 5 minutes. Okay? We're going to go ahead and place the towel over here. Okay, for the sake of the test, we're not going to actually wait 5 minutes. So I'm going to remove the foot from the water, okay, and place it on the towel. Go ahead, wet the first washcloth, put soap on 5 corners, 1, 2, 3, 4, and 5. Wash the top of the foot, side of the foot, flip it over, side of the foot, flip it over, bottom of the foot, flip it over, and between the toes. This is dirty. Go ahead and dip this. No soap needed because we're going to be rinsing. So wash the top of the foot, flip it over, bottom of the foot, flip it over, side, flip it over, side, flip it over, and between the toes. We're going to go ahead and dry, pat dry, also between the toes. We're going to put lotion. Put lotion all over the foot, not in between the toes, and then wipe off the excess lotion. Put her sock back on, remove this chuck and the towel, cover the patient back up, place this in the dirty designated area. Okay, rinse the basin and then dry it. Make sure you put everything away in the dirty designated area. Put away the chuck. Remove the gloves, throw it in the trash, and then do your closing procedure.